Hey everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about another antidepressant. This one goes by the name of Duloxetine and has a brand name of Cymbalta. Before we get into the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. So in the past, when we talked about antidepressants, we mainly talked about SSRIs, or selective serotonin reuptake inhibitors. This time we're going to be talking about an SNRI, or a serotonin norepinephrine reuptake inhibitor. Between the different medications in this class, they all have a different affinity of how they affect serotonin versus norepinephrine. For duloxetine or Cymbalta, it has an equal affinity for both serotonin and norepinephrine. With high doses, there may be an effect on dopamine as well. So there are many different indications for this medication. The main one would be for depression, or MDD, that is major depressive disorder. Also generalized anxiety disorder. We do see it used to treat pain associated with diabetic peripheral neuropathy. Duloxetine seems to be the only medication in this class of SNRIs that can be used to treat pain due to fibromyalgia. In individuals who have bipolar disorder, it can be used during the depressed phase. It can be used in postpartum depression as well as dysthymia. Some double-blind and open trials have found that duloxetine can help with OCD. Case reports have shown that it may help with chronic fatigue syndrome. And some women who are experiencing hot flashes due to menopause may benefit from duloxetine. It can be used for migraines and tension headaches, as well as stress-induced urinary incontinence. Now, before somebody was to start using this medication, there are some warnings or precautions that they should be made aware of. All patients, when starting this medication or increasing or decreasing the dose, must be closely monitored for any signs of suicidal ideation. They should also be screened for worsening of their depression that they're trying to treat. Duloxetine should be avoided in patients who have severe renal insufficiency, so that would be a creatinine clearance of less than 30 mL per min. You would do your best to avoid giving this medication to patients who have underlying liver disease, and you would not use this medication in individuals who had chronic alcoholism, chronic liver disease, or hepatic insufficiency. Because of that effect on norepinephrine, SNRIs have the ability to affect blood pressure on the long-term basis. For that reason, some physicians like to avoid using this medication in individuals who have uncontrolled high blood pressure. Fortunately, this medication can induce mania in individuals who do have bipolar. Therefore, great caution must be used if this medication is ever to be given during the depressed phase in an individual who has bipolar. And similarly to what we discussed with the SSRIs, this medication, because it does affect serotonin, can contribute to serotonin syndrome, typically if you're using other medications that affect serotonin as well. So once somebody is made aware of all the precautions and they feel comfortable using the medication and they start it, it's typically started on a dose of 30 milligrams and then increased over time to 60 milligrams twice daily. Some studies have tried to initiate the dose at 60 milligrams rather than 30, but they found that there were some negative consequences in that a lot of people experience nausea. It can be given with or without food. However, it should be noted that the time to reach max concentration in the blood is delayed by 6 to 10 hours if you do take it with a meal. It should be noted that there's a 3-hour delay in absorption as well as a 30% increase in clearance during an evening dose when compared to a morning dose. The bioavailability, or how much of the medication reaches the bloodstream, is decreased by 30% in smokers. The half-life is increased to about 48 hours in those who have liver disease. Now, while somebody's using this medication, there are some adverse effects or side effects that they may experience. Over 10% of people can experience insomnia, while the same percentage, again over 10, can experience sedation. Less than 2% of individuals experience excitement or hypomania. Headache or general fatigue comes in at about 10%. Some people do experience some anticholinergic effects from this medication, so dry mouth, constipation, blurred vision, or sweating. All of these occur over 10% of the time, except for blurred vision. That happens around 2% of the time. Some people could experience some extrapyramidal side effects, like tremors. This happens in about 2% of people as well. Orthostatic hypotension, or dizziness, can happen over 10% of the time. Rapid heart rate or heart palpitations can happen about 3% of the time. GI distress is common. And the next side effect, sexual dysfunction, is the most common side effect that people do experience. 30% of people that take this medication will experience some sort of sexual side effect, whether that's a decrease in performance or a decrease in libido. That's all the side effects we're going to talk about with this medication. The last thing I should touch on before I close out the video is that these medications do take some time to you notice an effect. So around 7 to 28 days at least before you really notice an effect from it. Some people experience side effects in the beginning and not much benefit. So a lot of these people end up stopping the medication because they're only experiencing side effects and no benefit. So as long as people are aware that it takes time, they can have the confidence to push through and get to that point where they need to be. So that's it for today's video. As always, I'm thankful that you took the time to come by and watch one of my videos. If you'd like to help grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out below if you'd like to support the channel further.